Bismillahirrahmanirrahim. This is the first video of a new series aimed to comment on some imagings, MRI, X-ray, CT, and so on regarding rheumatology and musculoskeletal system. If it achieved the good number of attendant or viewers and comments and so on, I will continue on this series, and we will start by this X-ray, and I ask you to comment on this. You can stop the video here and comment, write your comment on paper, for example, on your laptop, your computer, your mobile phone, and then you can replay the video to assure if you are correct on if your comment are correct or not. So you can stop this video here and then replay. Yes, we are again here. This X-ray, if you want to comment, scientific comment, you will say what type of imaging for the start. This is X-ray, so it is not CT, it is not MRI, it is not BET, and so on. It is an X-ray. On what region? Yes, lumbosacral spine. So this is X-ray lumbosacral. Which view? This is this view is both the anteroposterior and the lateral view. Remember that in X-ray we have anteroposterior, lateral, and oblique, for example, views, but in the MRI they are different names. They are sagittal, coronal, and transverse. In this X-ray we have both anterior in the left side and lateral on the right side. So this is X-ray lumbosacral spine on anteroposterior and lateral view showing. First of all, what about alignment? Is there any problem in the alignment? Yes, there is decreased or lost lumbar lordosis. The lumbar spine here are more or less at the same line, so there is no curve here. So they are lost. There is a lost lumbar curvature or lost lumbar lordosis, which means there is muscle spasm in this patient. So the first is there is lost lumbar lordosis, which is one of the alignment problems. Other alignment, there is no spondylolisthesis, there is no retrolisthesis. You know, spondylolisthesis means that the above vertebra is pushed forward. Retrolisthesis is the opposite. The above or the higher vertebra is pushed backward. On the anteroposterior view, there is no scoliosis, so there is no other alignment problem. What about the disc spaces here? They are more or less within normal. You cannot exclude 100% disc problem by X-ray, but just we can see if there is disc narrowing or so on. I cannot see anything other here, but in the lateral view we cannot see many things. In the anteroposterior you can find important thing here. T12 and this is L1. How we know this? This vertebra, I put my finger here. This vertebra has a rib emerging from it, so this is T12 for sure. This has no rib, so this is L1. Count with me: L1, L2, L3, L4. Where is L5? L5 is included in the sacrum. This is called sacralized L5. Sometimes the vertebrae are not 5 lumbar and 5 sacrum. they may be 4 lumbar as in this case and 6 sacrum, which we mean by sacralized L5. So we have L1, L2, L3, L4, but L5 is pushed into the sacrum, becoming one of the sacral vertebrae. So we have 4 lumbar here and 6 sacral, if we can say. The opposite is lumbarized S1, which means that the lumbar vertebra may be 6. One of the sacral vertebra S1 is separated from the sacrum and became similar to the lumbar vertebra. So we have here sacralized L5 and lumbar muscle spasm, both of which can cause back pain. The management of sacralized L5 is usually conservative. There is no need for surgery. Rehabilitation and physiotherapy may help. Muscle relaxant may help. The patient may complain of neuropathic pain or radiculopathy or so on, and the treatment is dependent on the symptomatology. So this is the first X-ray in this series and the first video. And as I say before, if this video achieved reactions from you, comments, views, and likes, I will continue on the series. If not, I will stop. And Assalamu alaikum wa rahmatullahi wa barakatuh.